Although it's reported that the Omicron variant is less likely to cause death, it is considerably easier to pass along. And with a shortage of tests, conflicting information on quarantine times, and a debate raging over whether in-class education is safe right now, there is a lot to talk about. So let's get right to our friend, Dr. Jeffrey Sterling from Simcoe, Illinois, Managed Preventative Care. He joins us by Zoom. Hi, doctor.
Hi, it's a pleasure to be with you. Happy New Year.
Happy New Year to you. Unfortunately, it is another year where this pandemic is dragging on. What is the latest that we know about Omicron?
Well, you touched on Omicron, and it's just amazing that in just a matter of weeks, Omicron is now about 95% of COVID cases. So, there's a distinction that hasn't yet proven that it's going to be worth a difference. You mentioned that it's way more transmissible, but it doesn't appear to be as deadly as its predecessor, Delta. However, the fact of the matter is that if so many more people end up with it, then the math equation ends up pretty much the same. And, just think about it. On Monday, we actually saw 1 million cases in the United States. Over the last 7 days, the average has been over 500,000 cases a day. So Omicron is going to make up in volume what it may not do in individual lethality, so to speak.
So we're seeing record numbers of cases here in Illinois as well as around the country, as you mentioned. Is there any indication of when we could reach a peak with Omicron, especially as we look to what has happened in other countries like South Africa?
Well, you mentioned South Africa, and the encouraging news that's coming out of South Africa is that they actually have passed their peak without a necessarily high number of deaths. As these things go, you see an increase in cases, then you see an increase in hospitalizations, and then deaths follow that. So if we follow the curve that occurred in South Africa, we'd be relatively pleased with that, because one of the things that's important to point out is that an unintended consequence of Omicron, and this is a best case scenario, not a prediction, is that if enough people do catch it and subsequently develop natural immunity, theoretically, that could propel the country closer toward what we call herd immunity, where a sufficient number of us actually have some level of natural community combined with what's happening via the vaccination campaign that's going on around the world. We just don't know if that's going to be the case in the United States, because those of us still with risk, including the elderly, those who are immunocompromised, and otherwise inclined to have a higher risk of death. We still have to see how that plays out. So until proven otherwise, there's no reason to be encouraged by anything that's happening elsewhere. We still need to take the same precautions that have long been recommended.
So let's talk about what's happening with the schools, because there is a big debate raging right now over whether in-person classes should continue. What's your perspective on that? It seems like most people agree that the best place for the kids to be is in class, in person, but how do you do that safely?
Well, it's fascinating. I think that everyone would do well to take a step back and think about the various levels and perspectives that are in play here. From the children's perspectives, in the city of Chicago, it's amazing just how many people are now hospitalized across Chicago. Between Florida, Illinois, New York, New Jersey, and Illinois, these 5 states are actually leading the way across the country in terms of this massive number of pediatric hospitalizations. So we have to be concerned about placing our kids at risk. However, coming off of the other surges, we do know that there are dramatic consequences for kids being at home. There's long-term socialization and other considerations that really are being lost. So homeschooling isn't a simple answer in this regard. Now, because the number of infections are occurring in the pediatric population, even if they don't get as sick as adults historically have, that's where the teachers' concerns come into play. Teachers don't want to necessarily put themselves in an environment where all of these children are going to be infecting them, and given that they're older and may have immunocompromised statuses, that would lead to them bearing the brunt of these massive infections. And another variable that's been thrown into the mix is the cost to our community. Admittedly, not death, but the loss in the economy and the burden that's being placed on parents to have to care for kids who would otherwise be in school. It's just a tremendous number of variables that have to be considered. But the truth of the matter is that, first we do no harm, and there is an answer to the question. The answer to the question really is that if we picked up our vaccination campaign and now the CDC is recommending scenarios in which with the Pfizer vaccine and subsequently the Pfizer booster, we can now get kids vaccinated and or boosted all the way down to age 5. So if we want to get ourselves out of this situation, the answer to the question is perhaps we should take a pause and just really have an intensive campaign where we get as many of our kids vaccinated as quickly as possible so there will be less of a concern for them being in school environments.
What did you make of the CDC decision to cut the isolation time for people who have been exposed to COVID-19, and does that just further confuse people who are trying to figure out how to navigate all of these changes?
Well, it definitely confuses people, and to be honest with you, frankly, it broke my heart. I don't think that the data was, or the recommendation was based on data and the way in which the recommendations historically have been. People should remember, you can transmit, in other words, this is contagious anywhere from 2 days after you've been exposed to someone up to 14 days afterwards. So even the 10-day quarantine recommendation that was previously made was somewhat of a concession because we realized that you can still be infectious up to 14 days out. So the new recommendation that pushed that all the way back down to 5, and the reasoning for that was not based on data that said, hey, we have new data that shows that it's okay, you're not infectious after 5 days. Specifically, the recommendation was based on the fact that shows that the majority of transmissions occur in the first 5 days. So it really was a decision that had some considerations of economic variables, people wanting to get people back to work and other such things. It really wasn't a decision that was based entirely on science and safety. So they've tried to clean that up a touch by saying, well, after 5 days, take a test, and if the test is negative, then you can mask for days 5 through 10. Well, you know, the truth of the matter is that people should be masking all day, every day anyway when they're in risky environments. But I think that if we're still looking at the science, your safer course of action is to stay quarantined for that entire 10-day period, if at all you're able to do so.
Okay, and last thing, Dr. Sterling, Flurona, I saw that in a headline and I was scratching my head. Is that something that we need to be concerned about as well? The flu and COVID at the same time?
Actually, yes. The term Flurona is kind of wacky, but the truth of the matter is that I'm glad it's being thrown out there because it's something that people like myself always talk about. The truth of the matter is that when you get infected with something like any type of bacterial infection, like pneumonia or even a virus, and it lowers your immune system, what ends up happening potentially is other illnesses, it's kind of like a pylon. They want to jump on and take advantage of you while you're weak. So the truth of the matter is that, excluding last year when everyone was at home, isolated and wearing masks, over the last 5 years, influenza has caused about 35,000 deaths a year in the United States. And we know this past year there were hundreds of thousands of deaths the last several years, obviously. There have been hundreds of thousands of deaths from this particular illness. So what is now being described is that phenomenon where if you get the flu first or if you get COVID-19, the other illness is trying to piggyback, jump on. And that has some pretty devastating consequences because when you have these infections and if they're overwhelming your immune system, these other things like the flu, which we may just normally have gotten over, they become just that much more potentially deadly. So if you find yourself in a situation where you have Flurona, both the flu and coronavirus simultaneously, you really need to be more diligent in making sure that you get the care that you need as soon as possible. All of that said, the best way to address any of this is the same as it's always been. An ounce of prevention is worth a pound of cure. And there are effective vaccines both for influenza and for COVID-19. So if you want to stay away from this, just do what you should have been doing all along. Get vaccinated, stay masked, involve yourself in social distancing, wash your hands, and warn other people and get tested if you've been exposed or have any respiratory symptoms.
All right, Dr. Sterling, so much great information there. We appreciate you as always. And you can find Dr. Sterling at simcoeillinois.com.